Good day. My name is Professor Dr. Anja Krumijs, and today I'm going to talk to you about the use of literature and the use of theory in qualitative research. Theory and literature are used in different ways in qualitative research. In some ways similar to in any other kind of research, but also often in its own particular way. And today I would like to talk about two ways in which you use literature. The first use of literature in qualitative research is actually quite ordinary. It is to underscore the relevance of the study that you propose in your article or in a grant proposal. In that kind of use, you have to refer to the literature and to show how the study that you're intend to undertake is new, is relevant, has not been done before. You will explain the niche, you will explain how seriously necessary the study is. You can use epidemiological data, quantitative data, all kinds of data, as long as you use those data to make sure your audience or the people who read your proposal have an understanding of how important it is that you actually really do this study. So, literature use number one. That is the same as in probably any other kind of research. There's also a second important way in which literature in qualitative research is used, and that is to determine or to describe or to explain the focus of your study. You use literature to identify relevant dimensions, concepts, or insights that help you to determine what exactly needs to be included in your study and what different things your study needs to focus on. So actually you have an idea for a research. You use literature to underscore and to convince your audience of the relevance and the need for your study. But then in the second way you use it to further determine what the research question should be like, or what your problem statement is. And this is inspired by a combination of talks to experts, theoretical frameworks, concepts, models, debates that you find in the literature when you search the libraries for relevant articles about the topic that you have in mind, but also about it is also inspired by approaches within qualitative research. I will not talk about that today because that is covered by other sessions in this course. And it is also, in the fourth place, determined by paradigms. Paradigms I will not talk about in this particular lecture, but I will talk about it in a separate recording. So, when we talk about inspiration from the literature, what does that actually mean? And how do you get from a research idea, an interesting topic, how do you get from there to a research question or a problem statement? And first of all, you use inspiration for literature. So you have a search, you know what topic you have read some relevant articles, you have discussed it with experts, and you have a set of keywords in mind. And you search the literature for articles that could shed light on your topic. It could be similar topics in other countries or in comparable contexts or situations. It could be topics that are closely related to your topic, etc. And so you do a search and you find literature that is relevant, you can shed light on what your topic should be including, what your study should be including. So you use this literature to determine what kind of concepts are out there already that may be interesting to your topic and that relate to your topic. You then search the literature for particular relevant ready-made frameworks. Frameworks, these kind of things with boxes and arrows and schemes that are out there in the literature. But you can also make these frameworks by combining all the different elements that you find in the literature. And the question then is, you pick whatever you think is relevant and applicable to your study. You look at all the literature that is out there that is relevant for your study or could be applicable, but you determine by yourself which of those are the best and why. And this will then lead to a set of sub-questions. So you have an idea for a study, you try to read about it as much as you can. You search the literature using keywords. You can also use articles that you already found and look at what kind of keywords they use. You can look at what kind of articles they refer, what kind of keywords are used in there. So you have a kind of a systematic expounding search, and after some time you have an idea, okay, well, this is all the possible directions that I could take my study in. These are all kind of dimensions that I should take into account in my study. You then may want to summarize or visualize that in a framework with boxes and arrows within the center, the topic of your study, and then all kind of boxes and concepts that have impact on what you want to study, and arrows that indicate in which directions those impacts go. And then after some time you have this overview and you will decide which of those concepts and which of those frameworks and which of those theories that you found in the literature you want to use. And you have to decide why they are the most fruitful, the most relevant for your study. And that would then lead to a set of sub-questions. And I'll give you an example to illustrate this. Let's say you want to know how general practitioners deal with patients from an ethnic background that differs from their own background. And you want to know if they communicate and approach these patients in the same way as patients who do not have a background that differs in ethnical sense. And then you read, and you come across, and you dive into the library, and you come across an article by Geert Hofstede. And Geert Hofstede has a very specific idea. He says, well, you have different types of culture. The doctor will belong to culture type A, and has this and this kind of practices and ways of communicating. The patient will belong to another type of culture, which includes other ways of communicating. And then you understand that both the doctor and the patient have different ideas about effective communication. And if you study that, you can see whether GPs deal with their patient in an appropriate way, considering what they think appropriate communication should be like. But you can also have a constructivist approach, and that takes the whole communication between doctors and patients in a different way. And in the constructivist approach, it is said that ethnicity is not something that somebody has or carries around. Ethnicity is something that sometimes plays a role and sometimes does not play a role in communication between different people. And it says that when two people are communicating and they are kind of, understanding each other and have and act according to the same kind of norms and values, and the communication goes smooth, nobody thinks of ethnic differences. But when a doctor and a patient communicate and the communication goes less well, and the doctor has the idea that the patient doesn't really pick up what he wants to tell the patient, then the doctor may ascribe this to an ethnic background. And when there is problems in the communication, then all of a sudden the doctor will start using ethnicity-based explanations for explaining the miscommunication. And then he will all of a sudden classify the patient as an ethnic minority, whereas when the communication goes smoothly, he doesn't even think about that. And that is a different approach compared to the one of Hofstede, where you from the beginning start to think that both people have different cultures. And so, besides Hofstede and the constructivist approach, there are many different ideas on how you can operationalize, how you can look, how you can study intercultural communication models if you want to know something more about how general practitioners deal with patients from a background that is ethnically different from their own. And this is, when you read, you come across Hofstede, you come across the constructivist, you come across critique of Hofstede, you come across critique of the constructionist, and you ponder and you think and you look at that, and you find and you decide which of those approaches to intercultural communication, Hofstede, constructivist or other models, are relevant in your study, and you use the critique that you find in your literature on either one to also argue for the kind of choices for which of these models or approaches you pick. You use literature as well to show clearly which of those particular stances you picked for your study, which you find interesting for your study. In other words, theory that you get from literature is about expectations about your topic that you form on the basis of a combination of the readings that you came across when you did a literature research, expertise that you yourself have or your supervisors have, a paradigm which I will talk about in another lecture, and the approaches within qualitative research that will be covered in other lectures in this course as well. So you use this theory to come across all the relevant dimensions that you think, according to your literature, should be highlighted, should be studied in the context of your study. You use that to frame the research question, and if you go back to the previous slide, if you use Hofstede, you would make a question like, what are the differences in communication style between Hofstede, or between the doctor and the patient? But if you have the constructivist approach, your research question might be, under what conditions does a doctor explain communication problems in terms of ethnic differences between themselves and their patients? So you see that the kind of approach you pick has repercussions for the way you frame your research question. You also use the literature to identify important issues and concepts and they underlie sub-questions. And I can give you another example here. Let's say you want to know, I'm an anthropologist, so my examples may be sometimes a bit anthropological, but it's the idea. Let's say you want to know why women in a particular part of Kenya do not make use of maternity healthcare services. And you go and dive into the literature and you come across all kinds of reasons why women in Africa, because in this particular part of Kenya there has been no studies, otherwise you wouldn't have to do them yourself. So you dive into the literature and you read that in similar countries or similar contexts, women do not make use of maternity healthcare services because of cultural reasons. And the particular area you have in mind is a nomadic area where people travel around on camels, on the back of camels, and you come across, and they are nomads with a particular own culture, so you can read about how notions of maternity care, local notions and about maternity care and what mothers need do not agree or are not the same as what doctors have to offer. So it could be cultural reasons for women to hesitate to go to the clinics. It could be practical reasons. If you have to travel around on the back of a camel, it may be not so easy to visit the maternal health clinics in time. It could be economic reasons. It could be too costly for a family to make a detour to visit the clinics, and due to gender relations that you may also read about somewhere in your literature, due to gender relations, families may decide not to invest too much in the woman who is pregnant. So reading the literature, you come across all kinds of dimensions: gender, finances, practical reasons, cultural reasons, reasons to do with knowledge, etc. And so you can make a kind of a framework with concepts and dimensions that visualize how the visiting of maternal clinics could be influenced by all kinds of different things. And so you define important issues and concepts. And you can say, well, based on this, I believe that gender may have an impact on the choices of women or the possibilities of women to visit the clinics regularly and in time. It could be that you say, well, I also think, considering what I know from other articles, that there might be a cultural issue, or that these people don't have trust in governmental systems, or that they have poor experiences, that if they go to the maternal clinics, the nurse is often not there, or there are no proper medications or devices to screen blood pressure or whatever. So you get a quite large overview of what might be at stake based on literature. Then you say, okay, if I want to know about the reasons in this particular area in Kenya, I need to look into culture, I need to look into gender, I need to look also in how culture and gender shape each other, because you understood from yet other literature that gender and culture are quite closely interlinked. So you define the important concepts, you define the important dimensions, and these become visible in all kinds of expectations. You can say, I expect culture to play a role, leading to a sub-question: what kind of role might culture play in the decisions that women take to visit or not visit a maternal clinic, and so forth and so further. And that is how that works. You read literature, you pick Hofstede or a constructivist approach, or, like in the Garessa example, you read your literature, and that helps you to see all kinds of issues and problems that you need to take along in your research to get a clear understanding on why women in this particular context have troubles visiting the maternal clinics in time. So what it boils down to is that the theory that you use to work your original idea and the problem that you started with into research questions, problem statements, and also in sub-questions that tell you what kind of dimension should be included in your study and why, actually is created by the researcher, the person who does all this search in the literature. And there is a lot of literature. It is the researcher who finds their own way through the literature, makes their own choices. These concepts are state of the art, are relevant. These concepts are criticized, I don't use them. These kind of things needs to be included, etc. So the theory and the starting point and the expectations on which you base your study, and on the basis of which you decide what kind of things you're going to look at within your qualitative study, is actually created by you while you do your research, your literature search. And this theory is sometimes very global and abstract. Could even be at the level of a paradigm, which I will talk about in a while, in the next recording. Very global and abstract. And could be like, I need to look into gender, I need to look into, more abstract concepts. But it can also be very model-like. You can have ready-made models that you found in the literature, and there might be, for instance, health promotion models that tell us a lot about the decisions, the elements that constitute the decisions that a patient makes to go for health or not. So health-seeking models that will give you a kind of an overview already of what could be at stake in the nomadic maternity clinic health-seeking behavior. So it could be that you create your own theory in a global and abstract way. You can make a framework yourself based on the literature, but it is possible that ready-made frameworks are available within the research, and there you can decide to pick those. Again, your choice. If the models are good, fine. If there's a lot of critique on the models, you may want to revise them or replace them or discard them and make your own models. You do that kind of thinking all by yourself. And that means that in the end you could say that qualitative research is ideally heuristic. And heuristic means that it should generate new or improved theoretical insights and or hypotheses, or in qualitative research rather, expectations. And this is how that works. Let's say you do a literature research and you read about all kinds of possible dimensions that might influence the communication between the GP and their patients of non-Dutch ethnic backgrounds. Those exist. Or you want to know more about women in Garissa and why, in this case it was Garissa, and why they don't go to maternal health care clinics as often and frequently as they should. You read in the literature, you come across models, Hofstede, constructivist approaches, ready-made health-seeking behavior models, etc. But then you go into, those only provide you with expectations, because you don't know how it is in Garissa. It is only, the literature only tells you what would be good things to look at when you try to understand the behavior of the women in Kenya. And so it helps you to generate expectations, hypotheses about the situation with the mothers or the women in Kenya. Then you go into the field, you collect information about all those topics, but in an open way. You don't decide in advance that is what you found in the literature is really as it is in Garissa. It only is a starting point to know at what kind of things to look. And then you will see that in the Kenyan context, gender may play a role, but not exactly in the same way as you found in the literature. That practical issues may play a role, transport, distance, money, finances, may play a role, but not exactly in the same way as you found in your literature. If that would be exactly the same, and it would already have been described for these women that you do your search on, your study wouldn't have been necessary. But the literature gives you directions on which to look at, and your data will show whether those directions were the right ones, whether there are, and because you do an open collection of data, you will also learn what is really true of your expectations and what needs to be adjusted. So you kind of use the literature as a starting point to define expectations, what you need to look at, and then your data will tell you how correct and how accurate your expectations were and where you need to change. So it's an ongoing working on theoretical insights in maternal health care, health-seeking behavior, or health-seeking behavior among pregnant women, or consultation-seeking behavior. And so that's an ongoing ball game. And you publish, the next person who will do a research on why women do or do not visit maternal clinics in another part of the world, reads your article and has new starting points in starting to look for more insights in why the women in that particular part of the world behave in the way they do. So in qualitative research, most studies are based and start and are grounded in an extensive literature review that gives you direction on what to look at, but not to close down, but to open up. How does this play a role in this particular context? Does it play a role? No. Do cultural beliefs play a role, and in exactly what way? Do gender relations play a role in this study among women, or do they play a role, and in exactly what way, and how does that converge or differ from what I have read in the literature? Now, there is one exception to these rules, to this observation, and that is grounded theory. You already probably heard about that. Grounded theory is an approach within qualitative research that does not want to study too much in advance, because they say theory should be grounded in reality. Grounded theory grounded in reality. And if you do too much literature research in advance, you already are primed too much, and you will look at particular things and maybe be blind for others. And grounded theorists will usually start with a very superficial, rudimentary literature search, and not with the search that I just described. And they do not use literature as a starting point, but they will write in their proposal that you should not use literature. They will use grounded theory arguments to set up their study and formulate very open questions that can go all kinds of ways. But you will learn more about that in other parts of this course. Now, the theory that you kind of created based on your literature search can be used in different ways. I already mentioned that it can be used to provide hypotheses and expectations that you then can look into, see if they remain intact on the basis of your empirical material, whether they need to be discarded, or whether they need the concepts and all the dimensions that you verify, the expectations that you based on your literatures, whether they need to be adjusted, modified. Theory can be used also to determine your search for relevant trends and patterns. It can be used, or you use it, to determine what concepts and issue matter, as I already mentioned. But it can also be used as a standard for assessment. And this is a slightly different use of theory, also possible in qualitative research. Let's say you want to know whether a particular new protocol for safety is introduced into a surgical ward in a hospital. So there's a new protocol to ensure safety of the patients that undergo surgery. And this protocol is based on a lot of studies, and it prescribes step by steps for your surgeons what they should take into consideration when they prepare for a particular surgery for a particular patient, what they should do during the surgery and what they should do after. So a complete protocol. And so that is based on a lot of studies. So the protocol can be seen as the outcome of a lot of studies and seen as the outcome of a lot of evidence that has already been done. And your study, you can see if step A to step B of that starting the standard, where the step A to B of this standard are being properly applied and implemented. And you can look at why and why not, what the problems are with the implementation of this particular protocol. So there, the protocol could be seen as the theoretical framework that you use, and your study will see whether this protocol is used properly or not properly. And whether this and you can use then implementation theory to see if the standard is being implemented according to the state of the art that is prescribed in the implementation theory. So that's a bit of a different way. You can use theory to structure your fieldwork. You go into the field, you're going to do observations, you're going to do open interviews, as open as you can, but still your theory in the back of your mind will tell you which kind of ideas and dimensions you need to focus on. It can sensitize you, it can help you to decide where and when and how during a very open interview you need to probe, dig deeper, ask more questions. It can help you to structure a description of a particular event. You see, you observe a particular event, and the way you summarize and the way you describe that event later, you can already keep the concepts and the dimensions of your study in mind in organizing that description. So let's say you do some observations in this Kenya context, you look around and you describe according to what you have been reading in the theory, and not just wild. You can use it as a basis for later analysis of your qualitative data, and you can also use it to structure your conclusions and your discussions and in the writing of your paper or your thesis or your article. So when you go and study and when you do your research project, please make sure in which way you are using your theory. Is it according to, this example of implementation? Make sure you know why you want to use it. Make sure you use state-of-the-art and appropriate theory. And you see, for instance, in many cases, and I gave this example of Hofstede. Hofstede has been criticized, and in anthropology and ethnography, his definition of culture and his approach to culture is heavily criticized and not used. So if you still want to use it, you have to make sure that you understand the critiques and you have had a good argumentation of why you still want to use it. Or you can say, I don't use Hofstede anymore because there's better approaches and I will take those. So you always need to make sure you are aware of the state of the art and how you relate in your theory to the state of the art. And so make sure you use appropriate state of the art related theory. And you can do that by, you can make sure that you do so by looking at journals and books and the books and the latest and the debates in those. You can ask your supervisor because he or she is supposed to be aware of the state of the art. You can look at the master program that you are following or your other courses in the if you have a PhD program. You can talk to experts, but make sure that you use the state of the art. Do not mix up theory and background information. So if I go back to the example of the women in Garissa, you use literature to paint the background and to paint the gaps, etc. In the current studies, and you explain on the basis of background and etc. Why you do your study. But theory is to operationalize your questions and to determine what kind of dimensions your study needs to go into. Different things, don't mix them up. And then be aware of the paradigm your work fits in. And in the course of this lecture, I will not talk about paradigms. I will do so in another lecture. Thank you very much for your attention, for listening.